Oh my God. Okay, listen. So we're gonna. You can do whatever you want to do. All right. Can one of is it going live? Okay. Well, hopefully one of our loyal fans will tell us if our microphone doesn't work. We're gonna be Michael Marchant. Where are you? Please tell us if our microphone works. So, we're here live in Miami. Lisa's back. Thank God.
Hello, I'm back.
Say hello to your adoring fans.
Yes, I took a vacation.
Yeah, it was so weird. I didn't even know it was happening. I had to get news from other people. We're sharing one microphone today because, as usual, the Health Tech Talk Show has issues. So it's going to be great. So we're here at the Young Health Leaders Summit. In case no one could tell, look at this spot they gave us.
It's like very fancy. I mean, this whole place is it's just lovely, and very sweet little environment. Like people are very engaged, really willing to do like group work, do stuff, talk, have great ideas. It's amazing.
Yeah,
I love it.
So listen, I imported Stefan Kanya down here to do an innovation workshop with me. Mostly he did all the work. He even brought slides that I hadn't seen until we started. But
slides, like they were very sweet. They were really good.
We just want everyone to know they did not have the 20th anniversary ONC logo on them.
Yeah. And I heard there might be a T-shirt. Also, that might be a hint about a future guest of the Health Tech Talk Show.
Oh, weird. I know. Wow. I wonder if no one can guess what we're talking about. But anyway, so that was great. Everybody actually participated. We're going to have a room, like all those people are going to go start businesses. Tomorrow, Lisa, tell them what you are going to be talking about.
Okay. So tomorrow, I'm going to be talking about things I've learned. That's pretty much it. And between now and tomorrow, I will actually create a presentation. It's going to be amazing. It's going to be like 4 words on it. It's going to be all kinds of great ideas I've had. Although, and this is a hint, kind of a callback to one of our guests today, the first slide will talk about death.
What the hell? Okay. Also, we're not wearing shoes, and everyone else has booties on. Apparently, this is kind of a clean room situation. We're not sure. So that's why we don't have shoes on. We as usual, we're unprepared for everything. Okay. So there's lots of stuff going on here. There's like this is like the cool kids crowd, right? Like tell us all the cool kids you've already seen, other than us.
I mean, I just spent some time with Sarah Hollaback, who is not only cool, she's also the most stylish person ever to exist in the entire world.
So hip.
Amazing, so hip, so cool. Yeah. Negative shout out to the person who haunted me last night on the airplane. But other than that, that's all I've seen so far. People in Miami are very beautiful, just saying.
Yeah, we're going to go back to our other cities after this and still feel like we're kind of good looking.
But for a slightly bigger fish in a smaller pond.
Yeah.
This is a very big pond/ocean.
Also, the devil was testing Lisa last night. That's what happened. And she did overcome. Okay, who's our first guest? We've got a bunch of guests here. Yeah, I mean, like you're sitting closest to the camera. Oh my gosh. Okay, so Melissa Danino. Melissa, come here on the camera and show everyone that you're here and you're also barefoot. Here she is. Melissa Danino is our boss. She does everything. And she actually recruited all of our guests for the show today. So our first guest.
I do want to say I had help with Moriam. Moriam was over there. She will be
yeah, Moriam. Listen, you guys, Moriam is like a big catch for Insana. You're going to hear all about her. All right, so Cachet, introduce yourself.
Absolutely. My name is Cachet Covard. I work with the Advancement League in my free time, but my daytime job is running strategic partnerships for a health tech company in the death care space called Guaranteed.
What?
Yeah.
Sorry, say it again.
Guaranteed. Because...
It's
of course.
guaranteed.
Absolutely.
Is that really why it's called that? Holy shit.
No, there's definitely more meaning behind it, but death is guaranteed.
Well,
it's the one thing.
It's
yes.
an incredible name for all kinds of reasons.
Yeah.
Such good branding. Okay,
Totally
Lisa,
knew about it. Totally knew about it.
You talk about death.
No. Cachet, I want to hear more about yourself and about Guaranteed. Tell us.
Sure.
You get to hold
Yeah,
awesome. My background is actually in healthcare administration. I started at Cleveland Clinic, where it's the organization that is trying to do everything it can to give folks a second chance. So really interesting to move to this space around death where it comes to accepting it and such. But our main goal is just to talk about it more, make it something that we're not so afraid of, and create experiences for patients and families that aren't so tragic. Too often we have folks who don't have a good death experience, and it's not the death that they're looking to have. And that's actually why this company was started, because our founder, her father didn't have a great experience, and with that, the family as well. And so we're here just to be able to give folks a better death, talk about it, and just make it something that we're now also afraid of.
Speaking of someone who's having, I think, as far as I can tell from the outside, a pretty good death is Jimmy Carter, who has been in palliative care for a long time now.
Yep.
Lived for over a year, well over a year, doing what he wants to do.
Yes.
You know, living his life out, not like pursuing really intense treatments or procedures or whatever, and just like having the best semi-public death that somebody could have, right?
Yeah, absolutely.
It's great. And I think there was just a study, maybe you know, that came out about that the results for people, how long they live if they start palliative care earlier, are better. So I'm sure you all do various types of research or collect research. Tell me more about like what you're seeing in the market.
Sure. So our goal is to how can we get folks much sooner. The average length of stay in hospice care specifically is around 17 days. That's absolutely not enough time. For sure. And then you think about the family too, in terms of all of the paperwork, insurance, planning for what comes after death too. There's no time during that period just to sit down and grieve. And so the sooner we can get folks on palliative care, on hospice care, knowledgeable about the resources they get, the better. Not only for the patient in terms of being able to have a comfortable death, but also giving them the chance to do exactly what they want to do. And we just had someone recently go on a cruise. We love that. Look, take time to do exactly what you want. Different times we have folks say, you know, I want to die at the beach. How can we make that happen? How can we make whatever experience you want able to come to fruition? And sometimes too, it's, you know, what type of mood lighting you want. Do you have a playlist? What favorite foods do you want to have before that time comes?
That's actually when we're going to find out Kat's musical taste is only when she's on her deathbed. She will never tell.
It's actually like a total secret. Like no
this
one
is
actually
how
knows.
we're gonna know. We're gonna find out because she's gonna like put it in her like final, like her last will and testament. Be like, here you go. Here's my music taste.
Here it is. Yeah, it's true. No one knows. No one knows. No one knows. So question. Difference between palliative care and hospice.
Sure. So palliative is keeping a patient and pain-free while they're seeking curative treatment. So a lot of oncology patients are often on palliative care because radiation and other therapies can be so intense on the body. Hospice care is you're not seeking that curative treatment anymore. Your goal is to be comfortable at home. And so we try to keep folks from going back to the ER or getting hospitalized because that goes against their goals of care. So what can we do to bring all of those services in the home so that when you do have episodes, we're there to take care of you and keep you comfortable?
It's also like it also goes to the goal of demystifying death, right? If you have more people who are in hospice care at home, more people can, their family, their friends, their community can like be more part of that process. It's not just a like, oh, they went off to the ER and we never saw them again. Or there was this terrible, like dramatic situation where they're being provided all kinds of attempts at life-saving treatment that are invasive and painful, to say nothing of extraordinarily expensive and disruptive, and really rob the person, the family, the community of like that time that they would have, just again, like shout out Jimmy Carter, his family, they've been together like this whole time.
Yeah,
Jimmy Carter, shout out Jimmy Carter.
God bless Georgia.
Best peanut farmer ever. Like honestly, let's be real.
I just didn't know we were going here, but that's, I guess. That's
I mean, he is once again, clearly I'm a big Jimmy Carter fan today. He is once again like showing like he's making an example of his own life, him and his family's life. Like to be like, look, you can do this, and like you're gonna have a good amount of time to like be with your family and do what you want to do. Yes. Lives in that tiny little house. It's like 3 bedrooms, like
talking about
1,200 square feet. Like that's his life.
That's all you need.
That's all you need.
All right. Hey, so tell us why you're here at the Young Health Leader Summit.
Absolutely. So I am here not only because 2 dear friends of mine are Alex and Antoine, but also because, yes, they're awesome. But it gives us a more intimate setting to make connections to build partnership, to talk about all the great things that each one of us is doing in a setting where you can actually come out of this knowing, some how-to guides, which we're going to talk about later today on strategic partnerships. How can you work with other organizations and get that customer over the line? But also in a setting that is just much more chill, we all probably look like we're going different places right now, but the goal is to, come as you will. However comfortable you are, we just want to create a space for folks to build meaningful connection. Yeah.
All right. Any parting words before we kick you out and get our next guest on here? We're just bringing them on here.
Look, if you haven't heard of Young Health Leader Summit before or Advancement League, definitely check us out. LinkedIn, Instagram, all the sites.
OMG. It is the Cool Kids Club. Like everybody, they're all here.
They're all here.
Yeah, they're all here.
No,
Thank you for
They're all
your
here.
time.
Thank you. Thanks for being on the talk show. All right, we got. Davika, you coming on the show here? What's going? You coming on here? What's happening? What's happening? We heard you just took a flight in with a newborn, or oh my God. Okay, all right.
Yes.
Davika Wood. I am Arla.
Yes.
Tell
Hi.
us more. Here. You hold that and just
Okay.
monologue. Tell us
Okay.
what it's like.
Hi.
Oh my God.
So who am I? So Devi for short, because it's easier. So founder of I Am Arla, a women's mental health platform. Our tagline is "Women's health is mental health."
I agree.
Heard it here first. Came up with it earlier. You're welcome.
On your flight over.
Literally on my flight over.
Oh.
My child went to sleep for 15 minutes and I was like,
Good
boom.
job.
Thank you. What do we do? So essentially it's a women's mental health platform and we're providing targeted psychotherapy, coaching and therapy to women at all like life cycle or milestones in their life. So think of like infertility, fertility, pregnancy, menopause, or gender-based trauma, which is my background and what I experienced. So that was the kind of story behind starting I Am Arla. Yeah.
All right. Wow. Okay. Holy shit.
Yeah, I mean, wow. You're not from here.
No.
That's also an important context.
No.
Is your work is it global? Is it global? Is it
I'm in London, I'm based in
Yes.
London, but it's a global platform, so obviously it's a digital platform. It works. Okay. Is it just for show?
We're not.
Okay.
Actually, it does. It's pretty sensitive. We just don't know.
Oh,
if
it is.
picks up if you're not holding it. We don't know. We don't know.
Okay. Well, hello. So obviously we're trying to go global because it's a digital platform. So we're trying to have the most amount of access to women everywhere. The whole concept that we kind of brought in was the fact that at the moment, having access to mental health services for a woman is terrible. In London, where I'm from, it's pretty much the worst it's ever been. We don't have enough people, we don't have enough resources, and women are struggling the most that they ever have because of post-pandemic. So first and foremost, obviously I want to solve the problem in the UK, but I think by building a digital platform, it will be able to go global and support as many women as possible.
So we're talking a little bit about telehealth here. Are we talking more like AI stuff? Like what's going on here with I Am Arla? Well, I mean,
okay, so we've tried to create something that's very human service driven. So I think that I love technology. My background's always been in digital health, telehealth. I think in terms of mental health, you can never solve the problem fully by bringing in tech and AI and getting rid of the people. So we bring the practitioners, the therapists, the psychotherapists as real life people onto our platform. And then we connect the women that need access to these people via a telehealth platform. We want to work with corporates and schools to try and bring those people physically into the organizations to help women transition in their like major life cycle moments. So whether somebody's struggling to get back to work after having a baby, or they've experienced something like gender-based trauma, they've experienced domestic abuse, and they want to go back into the workplace, we want the works and the organizations to basically fund a coach or a psychotherapist to help that person transition back into work more effectively. Therefore, kind of you're helping that woman to be more productive, less absenteeism, and happier, healthier, and just more content going back into work.
so you're using like real providers, hashtag amazing. We're into it. So in the US, we have like a pretty massive workforce shortage. Is it the same in the UK?
Yes.
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 It is. Worse, better?
I think it's probably maybe not as bad because we're a smaller tinier little island. So we have less people to provide services for. We're also slightly less fragmented in terms of we do have our national health system, which is, albeit it is fragmented, we have one public health system that supports and provides services across the whole nation.
Single payer.
Does it work? No.
That's what I'm talking about. It doesn't work.
I need to get in here real fast.
Shall we get into it?
The problems are the same, though. They truly are.
Yeah.
But they're solved better in America.
That is not true.
Didn't someone earlier say that they really like the health system in America? Somebody here, they were like, we love it. And I was
sorry,
like,
but it's honestly an insane thing to say.
who was it? Are you okay?
It's not okay.
It's not okay.
We have here. So in the U.S. we have many health systems. Many health systems sometimes competing, and then the
Competition is good for business.
but it's not in healthcare because there's not a free market. Cat, it's not a free market.
Well, it's because the federal government made it not
Wow,
a
that's
free market.
literally also
Stefan.
not true. Do not come. Do not come here. Yeah, Stefan's leaving. Do not come to the Health Tech Talk Show for serious economic analysis of the healthcare system. What I will say is that
real media.
we are not real media. We are not economists, who are also fake, by the way. Health economy is fake, also. Just side note there, just to be totally clear, right? I mean, I'm right. Okay, but there is also a private system in the UK. There's a companion private system as well. And that's a little bit of like skimming off the top, right? There's a little bit of that too. But in terms of just access, mental health access, show me a country that has like enough access to mental health and behavioral health care. Is there any?
Yeah, is there
No.
Is there
No.
one?
Totally not. The only way it's solved is if you have a very tight-knit community that provides community level support to people. That's the only secret solution.
And then join it up.
Yeah.
So you have to
yeah.
join up the community
Yeah.
with the primary care and the
That's
secondary
it.
care. If you don't start in the community and support people in their homes, you're never going to solve the problem because they're continuously going to be pushed into
Right.
the primary care and secondary care
Right.
where it's super expensive, really incumbent,
Right.
and they're going in for more advanced needs and advanced services, which are super expensive. So it's
Right.
we're
Or
like
when
in
it
a-
gets so bad that somebody is having many problems, having serious problems, having, other comorbidities, other issues, because these issues have been unaddressed so long in the system.
Yeah, exactly.
Yeah. What has your entrepreneurship journey been like? I mean, what is it like for you there? We know a lot about it here.
My journey. Right. My journey. So I started off doing cancer research and then I started doing my PhD and I hated doing that. People do it because it's amazing, but I just hated the pipetting. The pipetting was like, driving me mad. And so then I got introduced to a guy called Ali Parsa, who was the CEO of Babylon, which was like the first telehealth virtual.
We know about Babylon.
Oh my God. Okay, good.
know
And we know
things.
their former chief medical
We know
officer.
some
Right.
people.
Do you? Okay, cool. Because you know it went under.
We do.
Okay, it's public knowledge that. And then he's coming back to Health Europe to come and talk about.
Wait, what? We're going to
Yeah.
be there.
We
Yeah.
should interview him.
They
We
just
should.
yeah.
What's up? We're going to interview
We
you.
would like to hear about the decline and fall of Babylon.
Who is interviewing who here?
It doesn't matter. It doesn't matter. I'm joking.
Yeah, so he's
Will be there.
he's coming on to basically talk about the demise of Babylon, which I think is incredible.
Rise and fall of empires is a real thing.
Yeah.
If you call your company Babylon, what do you expect?
What do you expect?
What do you expect?
Where did it come from? He knew.
Babylon. Yeah, no, I mean, but I'm just saying, like, the fall.
You knew.
The fall.
Assyria. All right, keep going.
So I worked there. That was my first ever job when I was like 23. And then I fell in love with digital health and I was like, this is amazing. Tech can like transcend barriers, improve health equity. And then I went on to start my own business when I was 26, which was in the elderly care space. So it's all about improving access to care in the community. And I built what was like the Uber for care at the time. And then I scaled that for 4.5 years, exited when I was like 29, had some really like terrible experiences being a female founder and like raising cash from like all men and like male investors. And it was just a really like terrible environment. Learned a lot. And then after that, I vowed to never go back into it. Found another company. I worked for other startups, helped them scale. And then I decided I was actually like, no, I do want to do it again. So then I started iMarla and I was like, I'm back here for round 2.
Debbie's back.
She's back, motherfuckers. All right. Hey, so Debbie, so I am Marla, mental health for women. Like, what is the secret sauce there? Is it that your clinicians are focused primarily on the concerns and issues that women have, or is there something super fancy there that we don't know about? Can you tell us the secret sauce?
It's not fancy, but it's like, it definitely is just focusing on women, because I feel like women access for women is already super disadvantaged. And I feel like when women are experiencing these like huge major milestones in their life, they need a place where they can feel safe, supported, free from judgment, and the support needs to be really focused on helping them survive that crisis, and then also helping them to get through and become the best versions of themselves when they go to work as well. Because let's not forget, women want to be focused and career givers as well as being baby bearers and everything else.
According to that guy who gave that commencement speech.
Yes. Oh my God. That was a guy who was a douche.
Let me just say, if you're thinking of doing that, don't.
Yeah.
Don't.
Keep your mouth
do it.
shut. Keep your mouth shut.
The end.
Like
Yeah.
literally nobody needs to hear that.
No
It's not
one.
helpful,
No.
It's not cool,
It's
funny,
not cool.
It's not
Don't
cool.
do it.
Don't do it.
Don't. So yeah, there's no secret sauce. It's just about creating something where the practitioners are all focused on and have experience in supporting women. So whether it's people that are trained in, infertility issues or gender-based trauma or domestic abuse, I want the practitioners to be on the platform to know this inside out and know how to hold space for these women, and the women to come into the platform and know that they've got a community of other women around them. So we host events as well in person, when no topics off bar. Like, we want to talk really openly about everything and get rid of the taboo around mental health for women, and help people just to feel like they're supported and that they can be the best versions of themselves. Because I think women's health is mental health. And I think if women have strong mental health and that they are able to feel like they can overcome anything, we can literally achieve whatever the hell we want to achieve. And that's like the pretext behind IMR.
Yeah, that's what I'm talking about.
Shout out to the research that's happening now about how estrogen is key for mental health for women.
Right?
Yeah. So
Lisa
saying.
texted me this article last night. I think I forget, it was some normal news, a real media outlet. And I think your text to me was, because Lisa gives me all my news, she summarized it. She said, the point is we need estrogen. And I was like, it sounds reasonable. Okay, Debbie, so you are speaking today or tomorrow? Today? Okay. Okay, tell us what you're speaking about, and then tell us why you're here, and then we're going to kick you out.
The end. Shall I? We should take this to London. I'll see you in Amsterdam. Health.
You just say the word. Nothing more that we
Find
like
us a sponsor.
than being on.
Okay.
Do well with Red Eyes without Delta One.
We like
Yeah.
being on different
Business.
planes.
Okay. You don't want my child on the plane? You can take her. She's great. What was the question? What am I talking about? So I'm on a women's health platform with Priya from New Health. How do you pronounce it? New Health. She's amazing. And we're talking about all things women's health. TBD. You have to watch it to be there to know everything we're about to say. I'm not going to spill the beans. Why am I here? Just because I really, really think it's an amazing thing that Alex and Antoine have created. And I'm always up for supporting it. And so, yeah, love it. Love Priya. Love you guys. Love everyone. Leaders. Yeah, do you want to bring her on?
Are you going to go get her? See, Melissa.
She's coming. Priya's coming.
Okay.
Priya's coming.
Great.
That's it. There was no.
You already answered. Yeah.
Yay!
So many fans. I bet you
Is
have
there
1
loads?
million friend requests.
Have I? No.
Oh my God.
But
I don't even
friend
know.
request me anytime.
On LinkedIn.
On LinkedIn only.
Only on LinkedIn though. I am married. Just feel the fear and do it anyway. That's my biggest advice.
Feel the fear.
Yeah. If you feel scared about doing anything or starting a business, like, it's normal, but just feel it and just do it, because you just don't want to have regrets. And I always think that, shit was hard when I was launching my first business, and really hard, but I don't regret a single second of it. In fact, I would do it all over again. And that's feel the fear and do it anyway. And I am doing it again. Oh, bless her. Yeah, to make a better world for her, because she's a woman to be. She's a little girl. Yeah, so she needs a better world to live in.
Love it. Cute.
Pleasure meeting you.
Nice to meet you guys. Thank you so much.
Oh my gosh. All right, we're going to have Moriam, then we're going to have Stefan, and apparently someone is getting Priya, because I don't know. All right. Okay. Don't go anywhere. I am going to insult the federal government a few more times, most likely, before you show up. We have Moriam Yarrow, who is actually get back here. Jesus Christ.
He tried to leave.
He's fine. Whatever. Anyway. Okay. Moriam Yarrow, why don't you introduce yourself?
Hi, everyone. I'm Maureen Yarrow, Senior Manager at Incenna. I'm also the Director of Community Impact with the Advancement League, and so super excited to be here. I feel kind of famous now.
Yeah. You are famous. So Incenna was like hiring, and I think I put something out on LinkedIn. And the great thing about Moriam is she did not follow any of the instructions. She just directly messaged me with like a really great message, and I was like, oh my god, I like this girl. And then we hired her. So here she is.
That's one of those things where it's like either it fails miserably and you go straight to the trash, or you are like you succeed dramatically and you are the winner.
It was like one of our fastest hires too.
Right.
It was like, boom.
It can usually it's a failure, just to be clear. Like don't try it.
It was a very
don't try it unless you're
LinkedIn
badass.
message. Yeah.
If you're not
Oh my
badass,
God,
don't try it.
We're gonna have you on the talk show.
Okay.
Sorry for
Yeah.
not telling you sooner.
Moriam is
All
still
right,
on the talk
okay,
show.
Moriam. So talk about the Advancement League. We know you're in charge of the Impactathon. Like, just tell us all those things.
The Advancement League is amazing. I really love YHLS mostly because of just like the feel of the conference. Like it really is anti-conference. I never came to a place where I felt like, oh, I can just come and be, and you don't really feel that power dynamic that you often feel at other conferences.
You don't feel like we're like emanating power.
You guys are powerful, but like we all feel powerful in the same space.
We are rodeo clowns.
And we can all be clowns here together, which is why I love it. Like it's just like I sometimes like waking up, putting on a suit is already like tiring enough. So I'm like, okay, I can wear jeans and maybe some comfortable shoes and not bleed at the end of the day. It's great. But outside of that, what I really enjoyed about the conference was being able to do, and so the Impactathon and what that whole part is, they do a community impact challenge every conference within the community that we're in. So last year we were in North Carolina, and so it's usually 24 hours. It's really not 24 hours, like let's say 8 hours, because I mean technically you can have a day, but
why have 24 when you can have 8?
Yeah,
Sure.
And so it brings a bunch of like the in a room brainstorming, and it feels like true innovation, like people from different parts, you don't know anyone, and everyone's just throwing ideas. So my team won last year.
Nice.
And we had no instructions whatsoever, and it was we had $500 in cash, and Antoine and Alex said, go and fly and be free. And we're like, okay, so what do we do with this cash? So last year we actually invested in the certifications of community health workers.
Wow.
Yeah. And it was in 24 hours, met with like the president of the North Carolina chapter, and we gave out enough money to give out 4 certifications. And so we actually did the podcast on Monday to raise awareness around like just the work community health workers do. And so it's just super exciting. So this year the format is slightly different. We wanted it to be more long-term and give folks about a week, and they still met some different folks and they came up with solutions. And so we'll find more out at 4:30 today.
Oh my gosh.
So cool.
Do you have more money this year?
We wish we did. And so hopefully next year we will, because I think that was the essence of it that I really like, that you really can feel the tangible impact that you're making. Like I felt so excited. Like I was probably talking about it to the car and the Uber at the hotel to the front desk person. Took the little big check that they gave me and took it back home. Like I was so geeked because like, oh my gosh, like we really did something in a few hours and like we won. So I hope we can do that next year, and just like make it bigger. But folks do get a cash prize this year, so that's kind of cool.
That's really interesting. So I also agree. I think that there's this like really magical thing that can happen when you get people in a room together to do like, let's figure this thing out. And you really get people who are excited about it. Yeah. I also think there's so many things I like about the Advancement League, but also at Civitas, my actual real job, my real day job, the one that the thing I do most of the time when not being a rodeo clown on the Health Tech Talk Show is to is one of the things we do with our members. We have the Emerging Leaders Council, and here at at YHLS today is Nikki on our team, who's also part of the Emerging Leaders Council. And you just gave me an idea that maybe we could bring like the Impactathon to our ELC gathering at our Civitas conference in October.
Go making a difference.
That's a really good idea.
Moria.
Because those are a bunch of really smart people who are like not the VPs at their organizations, but they have incredible experiences. They have a lot of enthusiasm. They do a lot of great work together. So this is a great idea. Yeah. I might steal it. No, Nikki's going to be reaching out to you, Moriam.
Delegation.
Nikki, if you're watching this, you're going to be reaching out to Moriam.
I've met her, so
they were in the same group. They were in the same innovation group. Exactly. So look at that.
Look, it's
all the pieces are coming together.
Yeah.
But there's what I would say for any company, any health tech company, any organization in the space, you cannot go wrong by investing in up and coming leaders in your organization. You literally, you can't go wrong. There's like no downside. There is only upside, and it's worth putting money against it, worth putting time against it, worth giving up some of your like power, whatever that is. Like there's never a downside. Never downside.
I agree. I do it.
Okay, Moriam, you too, I'm sure, have at least 4,000 LinkedIn requests. What would you like to tell all of your new fans?
Honestly, just take that time to do what you love. I think I find so much joy being at this conference and getting to connect with a bunch of folks, and like sometimes you don't prioritize those things, and that really is what carries you through day in and day out. And so I love giving back to the community, incorporating it into the work. So continue to find things that make you happy, because it's well, as you know, death is guaranteed, but and to enjoy the process, you know.
What a genius name. I love it. I appreciate it. Shout out to whoever created the name of
Yeah, it was her.
Shout out to
So do what makes you happy, because hey, when you die, at least you have those moments.
That's right. Yeah, that's what I'm talking about.
Yeah,
All right. Thank you, Moriam. Moriam Yarrow. Everybody become her friend on LinkedIn. All right, Stefan. No, it's Stefan's turn. Yeah, what the hell? Oh, Jesus Christ. Stefan.
No.
Okay.
It's right now.
You're doing it later, right?
No, this is it. This is your chance.
Be careful.
Look at that. Ladies first. I love it. Everybody's just barefoot here.
We had to be.
Oh my God, I love it. Oh, Stefan's wearing booties. I don't know. Priya.
Hi.
Oh my gosh, how do you pronounce your company name?
New Health.
New. Oh my gosh. Okay, so we just heard all about you from our new friend Debbie, not to be confused with her real name. Yeah, and she said you were amazing. And then I was like, why didn't we have Priya on the show? We're like going to dinner with her and everything. And then then Melissa went and got you. So you do a lot of things. I think we met when you were at the AHA, and now you've got your own business and you're doing all this like awesome stuff. So tell us about yourself and your company.
So myself, I do a lot of things. I have some revenue generating and some not, as you do, Kat.
Or revenue negative.
Yes, those two. So I started a company about 20 months ago called New Health that is focused on improving access to health and healthcare for women. And I didn't really have a specific plan in mind other than to throw things against the wall and see what I enjoyed doing and what I didn't enjoy and where I could have the most impact. So I'm doing a lot of consulting for startups and helping them build relationships with hospitals and health systems. And over the course of the last 20 months, I realized my whole background is in hospitals, and that's where I feel the most comfortable and I have the most experience. And so process of shifting New to be focused really on creating a guidebook for hospitals that want to improve access to women's health. So 2 pathways, right? How do you do that for your patients and communities and build service lines that actually support women across the continuum of their lives? And then second, how do you do it for the women in your workforce? Healthcare, as you know, Kat, is predominantly women.
80%.
Yep. And so we have a huge opportunity to offer benefits, policies, procedures that can support women who are in the workforce and, retain and attract women to healthcare.
Yeah, and not just in the workforce, but also at the bedside, in the supportive roles, in the everything, every level of staff. Not as much in the leadership roles, but in lots of roles that are not as well paid as the top paid person in that hospital. And that's really important.
Yeah. I mean, and I think we overlook that a lot, especially for those of us who had corporate jobs and we've sat at our desks from 9 to 5. And, we understand what it means for a woman to have the support she needs when she's sitting behind a desk. But what does it mean when she's a nurse and she's on her feet 24/7 when she's at work, right? Or, thinking outside of healthcare, like a line worker, right? Perhaps providing a solution for them is as simple as cotton uniforms because they may have hot flashes while they're going through perimenopause and menopause.
Estrogen.
Yeah,
Menopause.
estrogen.
Estrogen, very important.
Yeah, very important.
Just to be clear, I feel like Kat has like made it sound like I'm not having hot flashes.
She's not.
I'm just angry.
We don't even know we were in perimenopause.
No,
we don't even know. But when it happens,
this
we're
is
ready.
how I am all the time.
Well, I will say, like, I've been doing some work with some startups in the menopause place, and I've just been reading and learning more about it. And I don't know if it's just psychologically, but I'm like, I must be going through perimenopause. Right. Like when I have brain fog or I can't remember something, it must be the perimenopause. Right. And I don't know for sure that that's what it is. I'm in the right age range, but
there was that.
Yeah.
It's like all over my Instagram, so I feel like it's true.
Yeah, I know.
It's like,
I forget who wrote that, but there was a tweet I sent you that was someone said like, I'm just going to start a business where I just answer the phone, women call and say like, yep, must be perimenopause. I'll just be right all the time.
It's like the new thing because it used to be stress. It used to be like, oh, you just have stress.
Well, I think it's just so powerful that there's so much conversation about it. And that's the other half of what I'm trying to do through New Health is to expand conversation and make it normal to talk about these things. Because we don't as women. Right. We think we have to suffer alone. We think we're the only ones that have gone through this.
I might be the exception. I am not suffering alone. But that's just me.
I'm not alone.
You're not alone. We're all together.
Everybody knows what's going on.
We're all together.
And we need more of that. We need more, and it's not just menopause and perimenopause. It's stress, it's anxiety, it's the mental health challenges, the mother load that comes with being able to have a full-time job and have kids and have a spouse and do all the things that you need to do at home and in the workplace.
I'm just really eager for there to be more, and I feel like there has been more conversation and more work, meaningful work being done on women's healthcare that isn't just about reproductive healthcare. Yeah. Right?
We do more than have babies.
Yeah, I don't have any babies. So, I think that once we can really not just expand the conversation and the awareness, but also expand the tools, the drugs, the devices, the solutions, the approach, the way that care is actually delivered to women, is so super, super overdue.
Yeah. And it's all connected, right?
Yeah.
I think that's what our healthcare system hasn't acknowledged fully yet is so we talk a lot about reproductive care and maternal health, but we don't talk enough about how does that impact a woman later in her life? Right. How does it impact her cardiac health? How does it impact her mental health? How does it impact her hormonal load throughout the rest of her life, right? And we don't connect the dots for clinicians who aren't trained or educated in these areas. We aren't connecting the dots for patients who don't understand these connections. And so there is a lot to be done. And when I talk about it, I put this great graphic up, and I will in our panel later today.
Don't spoil it.
Yeah. That talks about what exactly women's health is and all the areas that it covers. But we have to be paying attention to cognitive health, brain health, heart health, all of those things that impact women differently because of estrogen.
Right.
It all comes back to estrogen.
It does all come back to estrogen. It's not the only hormone that we have, but it's a really important one. And there's just been such a ignoring of the effect of different levels of estrogen on women's health all around. It's just I want to say it's odd, but I know it's not because that's how the system works. What I'm kind of comparing it to is like primary care physicians. They do so much amazing work. They do so many things. Other primary care providers and NPs doing this work, they do great work. But it's the same thing with like mental and behavioral health. There are lots of things a primary care physician can do, but maybe isn't the best person to do in a magical world where we had specialists who were truly trained and specializing in women's health in a broader way, right? Yeah. We have OBGYNs, we have other folks who are doing different types of hormonal health, but there isn't like a strong workforce of specially trained clinicians in a broad swath of women's health right now.
Yeah.
Lots of physicians, lots of primary care folks doing tons of this work, but like same thing, like a psychiatrist, their understanding of really what happens with brain health and with pharmaceuticals and the effect on it and all those things is just so much greater because of how they've specialized.
Yes.
You just don't have that.
Yeah, and I think we put a lot on our society on OBGYNs to be the women's health provider. And we know a lot of women go to OBs for their primary care too, right? And so we put a lot on these professionals who can't possibly be trained in everything that is happening within
woman is not just obstetrics and
Yes.
gynecology.
Right. And so, you know, I've talked to a lot of leaders in this space and a lot of women who are advocating for change. And one of the pieces that they are advocating for is that this education be taught across specialties, right? Because again, estrogen and how it impacts cardiac health, is that taught to cardiologists? How it impacts cognitive health. So 2 out of 3 individuals that have Alzheimer's are women. And we don't really know the cause. We have ideas of what could be causing that. But are those folks trained in what's happening in women's bodies and with their hormones? And so there's a lot more that needs to be done to sort of expand this conversation. And the first piece is research. So it's like very exciting to see the Biden-Harris and all their efforts around increasing research, because once we increase research, we can increase education, and then we can change how we're delivering care.
That's amazing.
Yeah. All right. Well, you too. I'm sure everybody loves you, and you have all these business offers in your inbox. Like, oh my God, so crazy. So you are speaking. It's going to be recorded, so you can probably pay Alex and Antoine money to see your presentation later. What would you like to tell your new adoring fans?
I would like to tell everyone to vote this November. If you aren't registered, register. If the people in your life are not registered, get them to register. We know that voting has a huge impact on women's health, and if we really want to move the needle forward, we got to vote.
And shout out there's a new Women's Health Political Action Committee.
Yes.
It's a bipartisan political action committee intended to fund things for women's health.
Yes.
Just like as of like a day ago.
It's like a week old.
Yes, a week ago.
So a lot of exciting in women's health space, but
I feel like we can plug that. It's bipartisan. Yeah. On our we can
it's women's health.
Yeah. If you're interested in the bipartisan women's health,
we plug things we like. Yeah. That's like the story. So yeah. Oh my gosh. Thank you, Priya. Thank you for randomly coming on our show. Super pumped. Excited for your presentation. And now we're going to have save the best for last over here, patiently waiting. All right. Are you coming on? Are you going to make it over?
But I think we just had a run of amazing women. And sorry, Stefan.
Yeah, he's fine. Come on over. Come on, Stefan, you're not going to take your shoes off? You're going to wear the booties?
Yeah, I didn't know at first. You guys
oh my gosh.
Sorry for my gross.
Wait, hold this. This is quite the production. I had no idea. I've only seen it through my little laptop, and it's got like a clean room here. Like they hand me booties when I walked in for my shoes. I'm like, is somebody going to get murdered in here? And I'm like, it's probably going to be me, my political career, my business career.
And the murder of
yeah.
I don't know. I don't know. It could be good.
Yeah, I'm both very excited for this. This is kind of random how this happened, but because we're both in the same place, and so I'm very excited for this, but also kind of terrified, because I've watched the show.
Yeah,
so
no, it's fine.
All right. So Stefan, we imported him down here.
But everyone needs to know, Stefan and I met a long time ago on the steps of the JP Morgan conference before either of us worked for the federal government back in the olden days.
2014,
something like that. So we go back.
You didn't even start at CMS?
Nope. Yeah. No, literally before, and you were like, I'm going to do this. And I was like, I'm going to do this.
I'm going to make a difference.
We're going to make a difference in the world, and look at us now, Stefan.
Yeah.
All right. Let's let Stefan introduce himself and tell our loyal fans, does he feel like he's making a difference all these years later?
So Stefan, Kanya, nice to meet all of you, and all of your fans. I know it's quite the wide audience. So it's I don't know if I've ever had an audience this big before. So thank you for that. And it's probably for good reason too. But Nice to meet you. I work at ONC. I'm one of the cogs in a wheel there, trying to help, but also sometimes causing trouble. I lead innovation for them and get to work with innovation ecosystems and help advance our agenda, look at kind of what's trending in the future, what's coming around the corner, and how we can start to think about how we can proactively be looking at what we should do. Yeah, years ago we were looking at AI, like what should we do, and now we're actually doing stuff on it, right? So I've got kind of a unique role. It's got things in my job description that say like build collaborative communities. Like, and as a federal employee, that's I think pretty rare. So excited to be here today and at YHLS. Thanks for the invitation as well. I know you had a lot to do with getting me on the agenda here, so I appreciate that. Yeah, but it's nice to help kind of build that next generation of like passionate people who want to make a difference and stuff. And your question, do I feel like I'm making a difference? I think the answer is it depends on the day. You know, some days you feel like, proud of the work you're doing and you are having an impact. And other days you're like, why don't people just see it? Or like, why do I suck at this? Or, whatever it may be. But I think that's what motivates people and like keeps them going forward, right? Feeling like you're never satisfied, right? You're never patting yourself on the back like, I'm awesome. I did it all. You kind of, yeah.
So, so Stefan just did a workshop for me.
With you,
on innovation, right? Because we want to get the next generation of innovators out there doing awesome stuff. And so Lisa often hears me joke about like innovation, bleh. And we make fun of stuff a lot. But Stefan, so like tell us what is innovation, and then tell us how you got into it, because you have an interesting kind of like weird public health background.
Okay.
Yeah, we're into it.
What is innovation? That's like asking somebody like, what is life? It's like I feel like, are there gummies involved here? Like what's this is very broad. Like
No, it's medical in Florida. The federal government does not. Oh, right.
Yes. Officially, yes.
Although a new day is dawning, which I think we mentioned on a previous show. A new day is dawning.
This is important.
A new day is dawning.
Just real quick, talk to us about marijuana.
Can I just say that
the
it looks
Biden
like a makeup applicator?
Yes,
it is not. I don't.
I don't wear makeup. The Biden administration, the Biden-Harris administration, has instructed the DEA to consider bringing down the classification of cannabis from a super scary heroin-like drug to a less scary, does other things type drug. That's my best summary for you. And it's really meaningful because it's been a long time coming, and there's a patchwork of, this is much like interoperability and data exchange, Stefan. Weird.
I like parallel.
There's a patchwork of laws across the country, which is very confusing and causing a lot of problems. And there is not the same federal standard, and maybe that will change things and make things easier.
We'll see.
Interoperability.
Back to Stefan's career.
Short version is I was a Marine, so that was my first foray into public service, I guess you could say.
I think I've seen one of your pictures.
Yeah, one day when I was like 18 and looked like I was 10, but yeah.
You still kind of do.
Yeah, right. So
why they let you in here to the Young Health Leaders.
That is right. They're like, wait a minute, he's how old? What? Wait, how long was your career? Like you were in state government for how long? And how long ago was that?
Yeah.
But yeah, after the military and after college, I ended up working for the state of Illinois. First job was Human Rights Commission. Second job was Department of Commerce. Did a lot of innovation ecosystem building, entrepreneurship ecosystem building. And then the third job was public health. And I had pretty senior roles in all those agencies. And when I was in public health, I was there at the time that the ACA was being kind of rolled out, and public health and healthcare in general was all kind of changing. So it was a good time to get in there and kind of learn on the job, so to speak. And started doing a lot of like the innovation ecosystem building that wasn't in my job description, but I knew it needed to be done. So it's kind of like more of a passion. I feel like that's probably the most common element of everybody that's out in the other room here is they're people that no matter what job they're going to have, they're here for this conference and this event. And more than likely, they're going to be the ones who are like doing something that's outside of the job description, not just the bare minimum, because they're passionate about it or they see a problem they want to challenge, take or a challenge they want to try to solve. And those are the kinds of people like I always try to like gravitate to and, use the 20 plus years in my career that I've like learned things and tactics and the role that government plays and figure out like, what can we do to support them on that journey,
So most people who I've talked to about you are like, why is that guy still in the government? He could do such great things in the private sector. So tell us why. Oh, Jesus. No, That would be pretty funny if you did leave. But tell us why you're sticking with the government here, making a difference, doing the things. I'm sure it is because of the incredibly high salary.
Oh yeah, I make 10 million a year. Yeah. No, I mean, you can see how much I make. You can go on, you can freedom of information. Yeah. No, it pays okay, but it's really more about the work. And it's hard. Like I remember when I first took the job, my person who hired me, well, I'll leave their name out of it. But he said, he's like, oh, I'd be surprised if you're here for 2 to 3 years. Like a job like this, a lot of people kind of get snagged and leave. And so then I get a lot of questions of like, why haven't you left? Like, does nobody want you?
Is that really where you went with that question?
No, my point is, people will say that, right?
Everybody wants Stefan.
No. The fact is like in government, in these positions, you get to work on so many things that are like impactful and have, like real world implications, not just for like other people, but for you and your own family. And so to be able to have that perch to like work across so many different diverse issues, constantly learning every day. Like for me in a career, in a position, like when I feel like I'm no longer learning or being challenged, that's when I feel the pressure to leave. In this job, that's never been a problem. Like I'm always learning. The issues are always changing, whether it's because the political climate has changed, or whether it's just because the times have changed in general. The things we're working on today are so different than what we worked on when I first started at ONC 10 years ago, right? We've evolved. And now that we're in our 20th anniversary this year, it's like amazing. Like we're already charting what is the next 10 years going to be like, right? And we know it's a totally different role than what it was for the first 20 years. I was lucky enough to be there for the middle 10, or to have been there. So it's one of those things where it's like you get wrapped up in so many different initiatives. You think like, oh, maybe I'll leave when this is wrapped up. But the reality is before you can wrap that, you've already taken on 2 or 3 other ones, and you're passionate about seeing those through to the finish line because you care about them, right? And I could say that about all my colleagues at ONC and a lot of the other federal agencies that we work with. I know you when you were at CMS, same thing, right? It's like it's hard to leave because like I'm almost going to be painted in a corner and not be able to have that level of influence, and so it's tough.
It's just the size of the problem space is so large.
Yeah.
And your ability as one person to affect a lot of people is massive.
And obviously one person in partnership with other people, both inside government, you're finding out and aligning. A lot of my work is dot connecting.
You're the guy.
You
look around, you turn around, you're like, there's somebody else?
Yeah.
And there's not actually.
A lot of times there isn't. But that's why it's important to be at events like this, because just like in government, it's the same thing in private sector and not-for-profit. There's a limited number, maybe it's a higher percentage in not-for-profit, right? Because the motivations are different there. Yeah. But the number of people who are willing to go outside of the job description and take on work that nobody's assigning to them, right? Creating their own work, right?
Are there that many in nonprofit? It depends. It depends.
Right, it
depends on what their structure is, why they exist, if they're just there to sort of like.
Well, I think the founders of I think a founder
sets the tone. Yeah, for sure. But there's it's a premium, right? There's not that many out there. It's a limited supply of finding those people who are willing to go above and beyond. They do exist in government, and I work with a lot of these colleagues. But it's I think it's true in private sector as well. Like you have a lot of people that come in, they clock in, they clock out, bare minimum. If you don't assign it to them, they're not working on it. And then you have other people come and be like, what can I do different, right? Or like, yeah, I've got these deadlines, but let me carve out time on my own time, in between time, whatever it might be, because this is important and I'm going to try to create this other work for myself, right? And so events like this are important because we need to backfill all those positions and make sure we get more people like that, because that's where like huge transformative change happens. Yeah.
Love it. Any innovation questions?
What is ONC innovating on?
That's a really good question. Well, as you know, as a federal agency, we can't talk about things that aren't public, right? So I got to be careful there.
That's like a move.
I can't talk about the things that like maybe are in the works behind the scenes.
The T-word is from 2015 or before. That's not innovation anymore.
That you might find out about in a few months. We'll see some big things, but yeah, we'll see what Mickey can talk about. I'll let him, talk about that in the future. Yeah. He's my boss. I got to follow like whatever he can say, publicly. So
I guess this is time for us to tell the world. Yeah, we forgot who's going to be on the show.
Oh, I have no idea.
Oh, it's your boss.
Oh, really?
Yeah.
No kidding. Look at that. There's a hot take.
Yeah. So dear loyal followers, we have both Mickey Tripathi and Jonathan Bush on the same episode on Friday of next week. I don't know. It was actually kind of an accident.
Do not miss, if you can possibly help it, do not miss the live version of next week's show, because it is going to be a hot mess, guaranteed. Mickey Tripathi, very lovely person, very, very skilled. Jonathan Bush, you never know what he's going to say.
He's like,
you never know
I
what he's
think
gonna
really
say.
the wild card is us. We don't know. We don't know what we're going to say.
No.
Back to stuff.
I am the wild card, and then Jonathan.
I would encourage you also to watch the live version, because who knows, like it could be so explosive that they might have to pull it down afterwards. So if,
it might be a
yeah,
one-time.
you never know. Catch it while you can.
You gotta be there.
You got to be
We don't
there.
know how to edit video, so
Yeah.
If they say we have to take the whole thing, we have to take the whole thing down. Like we can't. We
Yeah.
can't,
we've like tried to cut out parts where our video just
don't
dropped,
know.
and like we
We
even
don't know.
screwed that up.
Ugh.
Yeah.
Again,
Anyway.
if you would like to sponsor the show, you know how to reach us. Maybe we will someday have professional, beyond Melissa, who is very professional, video production.
Okay.
She's like, what
Yeah.
are you doing?
Yeah, I know. I think if you looked at, there's been a trend, if you've been watching ONC, like where in the last few years, we've definitely been getting asked by leadership across the administration to like lead more activity. So rather than being kind of like a coordinator when other agencies come to us, like we're being asked.
Coordinator.
Right. But coordinator, it depends on, again, how much people want to or feel empowered to lean in on that, right? And so we've definitely been getting a lot of support from certainly this administration on like expanding and like being much more actively engaged in leading, not just like coordinating from behind the scenes or on the sidelines. So certain examples, in behavioral health IT, maternal health IT, certain other areas where we look to a lot of other agencies and we expect them to be like, they are the ones who should be the leader in this area. But we've been asked to co-lead these efforts, or public health data modernization, right? And it's been a testament to a lot of the staff's hard work over the years and the fact that we look at it from a certain perspective. But it's been one of those ones where we are leading with SAMHSA and partnering with them and all their expertise. We're hitting it from the technology side, right? And then trying to lead these nuanced areas where before, like we just weren't as big of a role, right? We were kind of on the sidelines helping a little bit from behind the scenes. And in some cases where the agencies would come to us and ask for help, and we would then coordinate from that standpoint, where now there's an executive order or an order passed by the secretary that's called the Health IT Alignment Policy, where like they have to work with ONC on this. And there's like for procurement, for policy, for like all these things, have a whole, program on it. And we have like, resources for all the agencies to follow and all that. But now it's like, it's not an if or, as it's like convenient, but more it's like it has to happen. To make sure we have consistency and we're talking with one voice across federal government. So that's some of the ways, and I don't know if you call that innovation or not. Again, it's all your definition, but we are being asked to lead more and be involved in more big public-private partnerships, like CancerX, where the White House has asked us to lead a lot of that. And again, I think the coming months you'll see just how actively engaged we are on, branching out and being much more in a leadership role across the agency.
Wouldn't it be cool if Congress also gave you some additional authorities and money, which has been asked for at this point time immemorial? I think that Civitas in particular has been like co-signing the letter that's like, hey, you could give ONC more money and have them do more stuff for a long time.
Yeah, this is where I gotta make sure I don't get fired.
No, I'm saying the speaker.
Yeah, that's a great opinion that somebody's welcome to have. We worked very well with OMB and the administration on our budgetary needs. And then we work very closely with Congress to make sure we have what we need, and we'll continue to do that. And as we continue to be asked to kind of lead more and coordinate, in a more aggressive fashion, in supporting all these agencies, and the work in private, with private sector as well. Certain we're always flagging where like additional resources will be helpful to achieve that, to do it, right? It's no secret. There's a lot of examples in history for every agency, federal, state, local, where they have something called unfunded mandates, right? So like they pass a law or something happens, he says you have to do this, but then the money doesn't come along with it. So I'm not saying we don't have any of those situations right now. I'm just saying that, of course, whenever you're looking at, are there more things we can be doing? The question should always be, how can we make sure we've got the right support financially, authority-wise, whatever else it is, to be successful in doing that and delivering it. Right.
Well, if any members of Congress want to talk, I'm available.
You can also come on
Cat's
the Health Tech Talk Show.
You can come on the Health Tech Talk Show, and more there. So I think Stefan needs to give us his talking points here. What's your takeaway for
Well,
the?
Yeah. Well, what do you want to? What do you? Why? I mean, we know why you're here.
Cat made you be here.
No, but close out. Tell us why it's important to be here. Why you're excited to be here, and if you want to plug your Cancer X initiative
Sure.
that all of America knows about and loves, that's fine too.
Sure. With your support too. So.
yeah.
Yeah. So I guess I'll just, in close, repeat kind of a little bit of what I said before, but it's important to come here, and not just here, but things like this. Part of my role is actually getting out of the, DC bubble and meeting innovators where they are, because especially entrepreneurs or those who are kind of these hidden gems who are going to be the future innovators. They don't know anything about public comment periods, right? They don't know how to come to DC and meet and lobby and all that. They don't have those resources, even if they did know how to do it. So being accessible, coming to events like this, going outside of the bubble and meeting people in different communities. We have a whole program on Federal Health Innovation Days with a bunch of federal agencies who try to make it easier to understand government and access us. It's very crucial, in my opinion, to making sure that you're leveling the playing field, right? And more of these innovators and disruptors have a chance at actually making an impact on the market, not missing the boat just because they didn't hear about it or they couldn't access the government, right? And again, it could be something as simple as like a public comment period on an RFI that goes out, right? And you could think what's the impact of that? But when you've got the lobbying arms of these huge companies and industry giants who already have monopolies on the industry, right? And they are fully responding to that and shaping it all in their interest. And we're getting that input loud and clear. But then we don't get the startup entrepreneur, disruptor, non-for-profit voice, whatever else it may be. Then of course, we're going to have to react or try to fill in the blanks based on an assumption or something, right? So much easier we can defend it with, we got feedback from this type of stakeholder as well. And guess what? That doesn't really balance with what they're saying, right? Or vice versa. So a lot of people don't know, in ONC's mission, it actually says that we've got some duties that are around ensuring a competitive marketplace, an efficient marketplace, that are
I love competition.
it's in the High Tech Act. It's pretty awesome responsibilities, I think, that are buried down in there.
How's that going?
We're doing our best. I could point to examples. I mean,
Federal Health. Let me plug this. So the Federal Health Innovation Day series that you do, I know you've done it for a couple years.
Yeah, so we
I've
actually
been to a few of them.
So we actually started the model of that in the Trump administration. It was with the CTO's office as a partnership, and we called them HHS Startup Days. And then the pandemic hit, and the administrations changed. We weren't really traveling, but the cities, the ones who did have us come out, were like, "When can you come back out again? Are you starting to travel yet?" That was amazing. It's extremely valuable. It's been now 3-4 years. We'd love to have you come back out again. And of course, the cities that we never got to were like, "How come you never came to us in the first place? We know about this. We were on the queue. When can you come out?" So it was one of those things.
Oh,
Yeah.
we're getting out of here.
No worries.
All right. Where can people find out about Federal Health Innovation Days?
You can find out about them on social media. You can find out by subscribing to our newsletter at ONC and all of that. Yeah.
And then you can go meet Stefan in person. He's there. He will shake your hand. Okay. All right. Parting words.
She's right. I will shake your hand. I'm a handshaker. I'm sure. Yeah. Parting words.
All right. Yep.
Thanks.
All right. Thank you, Stefan.
Thank you, Stefan. All right. We're getting kicked out, so we got to go. So
see, remember, next week, do not miss it. Live show, regular time. It's going to be wild. We have no idea what's going to happen.
We will probably be wearing shoes.
We'll be wearing shoes, most likely.
Maybe. All right.
Possibly.
Okay. Goodbye.
Bye.